Good evening, everybody. We'll go ahead and call the meeting to order. We do not have any agenda changes at this time. And with that, I would ask the clerk to please call the roll.
Thank you, Mr. Chairman. Mr. Schultz. Here. Mr. Tassoni. Present. Mr. Webster. Here. Mr. Westcott. Present. Mr. Arena. Mr. Billich. Here. Mr. Booker.
Present.
Mr. Boomer.
Here.
Mr. Butita.
Here.
Mrs. Crosby. Here. Mr. Fellers.
Here.
Mr. Fiducia.
Here.
Mr. Gurl.
Present.
Mrs. Gorel.
Present.
Mr. Hoffman.
Present.
Mr. Kelly.
Here.
Mr. McDonald.
Present.
Mr. Neighbors.
Here.
Mrs. Red. Mr. Salgado.
Present.
18 present, 2 absent, Mr. Chairman.
Thank you very much, Clerk Gumau. With that, we have a special guest here tonight to take us through the invocation. Thanks to Mr. McDonald for bringing him in, recruiting him in. We have Chaplain Jesus Calvillo, who's a member of the Winnebago County Sheriff's Department and chaplain for the Rock River Chaplains Association. Thank you very much for being here. With that, we're going to turn things over to the chaplain and stand for the invocation and pledge.
Gracious and loving God, we thank you as we are able to come together to discuss the business of this county. Give wisdom to our county board and our chairman as they make the decisions of the issues that are brought before them. May we be able to be an example to other counties that even though there are differences, we can still work together and make the best decisions for our community. We present our first responders before you who serve and protect our community. Keep them safe and protect them at all times. Protect us, O God, from this virus that has spread so quickly throughout our world, and help us to take the proper precaution. And may your love, peace, joy, and blessing be upon our homes and families. In your name we pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Chaplain. Our first item of business, we have a presentation by the Sheriff's Department regarding jail staffing and also some updates on crime statistics. And so whomever from the department wants to come up, we got plenty of room for you right up here.
So, thank you, Mr. Chairman. So we actually have 2 PowerPoints to go through tonight. This is not the first one. We are going to go through the crime stats first, so let me see if I can. All right, well, we'll just do it like this so we get moving. So, just as background, a couple weeks back, Chairman Haney asked us if we could provide crime statistics to him, some historical crime data and some recent crime data. So, we put together some information, we passed it along to Chairman Haney, and then he asked if we could come to the board meeting tonight and present that. At the same time tonight, we're also going to present information in regards to the jail staffing study. I'm going to present this information on the crime statistics. I'll take questions at that point if you want to talk about that, because I don't want to mix the two issues. And then after we get done talking about the crime stats, we'll do a presentation on the jail staffing study, and then we'll take questions on that as well. So, again, if you don't know me, I'm Chief Deputy Rick Siganik. I came here from the Elgin Police Department about a month and a half ago. Super excited to be here. I've met a lot of the board members. I've met a lot of the public. Without being too long-winded, I'm real excited to be here, be part of this community, be part of everything that's happening here in Winnebago County. So, thank you for the opportunity to speak tonight, and thank you for having me. So, I'm going to go through this quickly because I know I'm a big believer in the 2 Bs. be brief and be gone. So I'll go through this quickly. If you have some questions at the end, we can move back to it. So here's a historical data for the last 4 years in Winnebago County. The first line you'll see there is calls for service. You can see in 2015, with 79,000 calls for service. In 2019, on the county side, this does not include the McChesney Park side, we were at 65,000 calls. The next line there is police reports written. Again, in 2015, you see we wrote 14,000 police reports on the county side. In 2019, we wrote 24,000 police reports. This, what's interesting about this is that while we may not be answering as many calls for services as we did 4 years ago, the time that each officer spends on a call has been increased greatly. And you see this in the police reports written, and there's a ton of reasons why that happens. Moving down, you can see citations hit a high in 2017, and we're about 5,000 in the county side for 2019. That probably goes along with the decrease in staffing over the last couple of years. Orders of protections, the number of order protections we're serving has remained pretty constant. We're at about 5,700 orders of protections in 2019, as opposed to 5,600 in 2015. Paper served has gone down, but that again would be because we have fewer people in the civil processing division serving papers. And again, here's the McChesney Park information. Calls for services in McChesney Park is 19,777. So as a whole, the Winnebago County Sheriff's Police Department answered approximately 85,000 calls for service last year. Again, you see this trend on the McChesney Park side, where the police officers are writing more police reports, which means they're spending more time on each call. And then again, citations issued is down from a high in 2016 or 2017. This is just, again, another way to look at the information I just gave you. You can see calls for service are down, but the number of police reports is going up. So we're writing more reports, we're spending more time on calls, we're taking more time with our customers in the community and making sure that they get the best service possible. Again, just another way of looking at the information with citations issued and order protections being served. Right, and just the chart. When you look in terms of crime stats, for again, we break this down in the sheriff's office between the county side and the McChesney Park side. This is on the county side. You can see that overall, over the four-year term, you'll see that there's a trend downward in overall Part 1 UCR violent crimes. When you see numbers like this, it's probably due to, you look at like 2016 is probably the high in there, and that's probably about the time that the different police agencies in this community started working together as a team. Prior to that, there was a lot of independent law enforcement action being taken place, and you'll see from 2016 and going forward, you'll see the sheriff's office, the city, the state, the federal agencies are all starting to work together, and that has an impact. Along those lines, community policing engagement and efforts also increased, and that also will help drive crime down. At Chesney Park, again, these stats are similar. You'll see that they're trending down, although between 2018 and 2019, it's kind of a flat line. We're just putting these numbers here. These are actual numbers for this year. It's year over year. February, a comparison to February of 2019 and 2020, and then a year-to-date between 2019 and 2020. On the county side, you'll see that in Part 1 crimes, that there's a trend down. When I put the McChesney Park numbers up here, you'll see that there's an increase. When you look at the increase, you'll see that the area where the most increase is car burglaries, vehicles being broken into. That's a difficult crime to pin one thing on. Often when you see people burglarizing crime or burglarizing cars, it's related to some other thing. A lot of times to a drug addiction. That's how drug addicts will get their money, breaking into cars, taking change, doing stuff like that. It's also something that when we see something like this, a spike come up like this, we will look for some strategies to try to reduce this. There's different ways to do that through education and through analyzing some of the crime data and directing our resources where the crime is occurring. Again, this is just another way to look at the two-year crime trends side by side in the Sheriff's Office and the McChesney Park Bureau. You can see overall there's a trend down. The trend is downward in crime, with the one exception in the McChesney Park area where they've seen a slight increase in assaults and batteries. But again, when you look at that number, the percentage change is not a number that I really like because, you know, in this case, you're talking about a small number of actual incidents, which will kind of skew percentage change and make it look greater than it is. But the number is relatively small. I think between 2018 and 2019, you're talking about like 6 additional incidents. This graph is very confusing to look at, to say the least, but I'll explain it, I'll break it down to you pretty simply. What this is a 4-year look at how quickly our 911 operators answer the calls for 911. And so the third line down, if you can see it right there, but it says it's 90%. If you look across the top, we answer all our 911, almost 90% of our 911 calls within 10 seconds of the phone ringing. So that's a great number. We want to help the people as quickly as we can. Our goal is, our goal is to be perfect and answer them immediately, but within 10 seconds is a great response to get the operator to answer. Our 911 center, you can see really the key statistic in here is the one on the far right, total calls. In 2019, our 911 center received 110,000 phone calls. Of those, a total combined between landline and 911 wireless, there were 52,000 911 calls. And if you look at the very far right, you can see that number is trending up. We were in 98,000 phone calls to the 911 center in 2015. 2019, it continues to rise. I would imagine that with what's happening currently in our society with the coronavirus and other stuff, that our 911 center is getting a lot of calls. They're just getting a lot of calls for information. So I anticipate that number will continue to rise. On the jail side, you can see over a 4-year trend here. The average number of days that the inmate stays inside the jail is increasing from 34 days in 2015 to 54 days in 2019. Again, here's a chart that's just showing over a several year period the average daily population. You can see daily population of the jail. You can see that over the last 4 years, it's been pretty consistent. We were right around 800 last year. That number peaked in 2012 with about 1,000 inmates daily, and we're down now to about 800 daily in the jail.
Could I just double check? So I thought we were down, I thought we just talked about this, we were closer to 700, am I?
So that's where we're at currently.
Okay.
That's the average for 2019.
Okay.
We don't have the 2019 year average yet. So
Gotcha.
the
I'm
average
sorry.
for 2019 was nearly 800 a day, and the current jail population is right around 700 today as we're standing up here.
Okay, so we've seen what appears to be a little bit of a change this year, but. we're
Little,
not-
yeah.
Okay,
Right.
I'm
And
sorry.
you see that if you look at over the years, it's up and down a little bit, but it's pretty consistent in that 750 to 800 range.
Okay.
700, 800. So.
Sorry about that.
No, that's okay, quite all right. So the last thing I want to end with is to let you know that currently crime data is reported to the FBI through what's called the UCR, the Uniform Crime Report. That looks at 8 Part 1 crimes or more major crimes and more serious crimes, and then a number of Part 2 crimes that are not considered to be as serious. The FBI is requiring that all law enforcement agencies in Illinois report data in what's called the NIBR system, the National Incident-Based Reporting System. We are transitioning to that. When our new records management system goes live later this year, we will transition and we will start reporting our crime data and capturing our crime data and reporting it back to the board, to the community, to everybody else through the NIBR system. What that means is that the NIBR system gathers a lot more information than the UCR did. NIBR's gathers information like arrestees, victims, place of location offenses. But the thing that's most significant is currently with the UCR, if someone's arrested and charged with 10 crimes, only the most serious offense is reported to the FBI. With NIBRS, all the offenses that someone's charged with are going to be reported to the FBI through the crime index. So that may show a change where we'll see crime numbers that look like crime is going up, but there really is not an increase in crime. It's just a different way of reporting numbers. I don't know. We're speculating that may happen. We've been told in some of the training that may happen. So we'll do that. But the benefit to NIBRS is that it gives us a truer picture and a more accurate picture of where crime is occurring, who the victims are, who the offenders are, and so that will allow us to analyze the data better and provide better police service. So with that, I have nothing else. Is there any questions?
Any questions on the crime stats? Seeing none?
All right.
Thank you very much.
So I'm going to have Sergeant Pont, Corrections Sergeant Pont, and Superintendent of the Jail, Bob Redmond, present the information on the staffing study. But I'll be up here to answer questions as well.
Thank you.
How you doing? The staffing study that I'm here to talk about is one that was just done by the Savages. They're a firm based out of Florida. Prior to this staffing study, the only other staffing study that I'm aware of was done by Mark Goldberg and Associates back in 2006. I've been with the county since 2001, so I was here when they did that staffing study of the facility. It's not surprising to me that the staffing study numbers are very, very close in numbers. The concept behind a direct supervision facility is just that. It's direct supervision, and it has very little to do with the number of inmates that are in that facility. Direct supervision is based off the posts that are required to safely and securely run the operations, to safely and securely house inmates and staff. Under the Administrative Code of the Jail Standards, 701.130, it defines what a direct supervision means. And as it states here, direct supervision means direct and continuous supervision of detainees by a jail officer on a 24-hour basis. The officer shall be in direct visual and oral contact with the detainees without any separation of security walls or barriers. So like I said, it's not surprising that the numbers came very close. I believe between the two studies, they're off by 6. And what the Savages report shows is that when the 2006 staffing study was done, we did not have the federal courthouse and we did not have the juvenile courthouse. So with the addition of those two buildings that we transfer inmates to is the 6 officers that they're the difference between the two staffing studies. Each courtroom requires 1 officer to take the inmate in. You have to have a holding cell officer, and then you have to have 2 officers transport from facility to facility. So, and I believe last year we transported over 22,000 inmates to all 4 buildings. Because we have the CJC, we have the PSB, we have juvenile, and we have the federal building now. Inside the study that they had, there were some areas of concern. PREA is one of them, and it was a concern of the U.S. Marshals. I am the PREA coordinator for the Winnebago County Sheriff's Department. Under PREA, which is the Prison Rape and Elimination Act, we have 45 standards that we have to meet, and we have to be certified every 3 years. If we fail to meet those standards, they can jeopardize federal grant money, which is not just for the Sheriff's Department, it's also for the counties that the facility is in. That was one area that was an area of concern. The second area of concern was the lockdowns by the marshals and the report, because we have had, due to staffing, we've had a lot of lockdowns. To give you an example of classification in our facility, under direct supervision, we're required to have 2 officers in there. 1 doing security rounds and watching inmates, and 1 doing confidential screening, risk assessments of the inmates. Due to our current levels, we only have 1 officer in there. So the area of concern is that if I'm sitting here interviewing her, everybody else is hearing the questions, so it's not being as confidential as we need to be. And that's a crucial point when we're classifying somebody, when we place them within the facility. We got to make sure they're not a sexual predator. We got to make sure that they're sexually vulnerable to being predators. These inmates need to stay in classification for up to 72 hours so we can monitor you. Some people come in drunk or on drugs. Well, we just can't put you in classification for an hour and then send you up to general population, because things change from the time you come in. That's just one area that was an area of concern. The second area of concern for classification was the female classification. We had to shut that down, and females that come in now go into 1 or 2 units, general population, or down at our medical unit, because we don't have the staff to staff 2 females to keep that unit running. So that was also a concern that was brought up during the staffing study. Excess lockdowns, back in 2017 and 18, when the IDOC came in and did their audits, because of staffing levels, they weren't meeting all the 30-minute checks, which is a requirement. If you have 2 housing units locked down and you have 1 officer, they basically have to run back and forth between 2 housing units to make sure that these times are getting hit. That doesn't account for if an inmate's having a problem, if there's a medical issue. That's just basically going back and forth, and the auditors actually did that. They actually went through, did a proper inspection of the cells of the inmates, and they said there's no way feasibly possible that 1 officer can run 2 housing units effectively if an inmate has to stop to ask a question, or if you have an emergency that needs to take place there. The other thing that they noticed that was an area of concern with the staffing study is they were actually dumbfounded that we didn't have any civilian people working in our facility. We have no receptionist that answers the phone, we have no mail person, we have no warehouse person. Those duties are being done between myself, a lieutenant, and a captain. So every day that we're there, we're doing the mail, we're answering calls from the publics. The phones that we can't get routed up to the 4th floor, and the person who's supposed to be watching the housing units on the 1st floor on the control is now your receptionist. So it's very cumbersome and not efficiency enough, but they were kind of floored that we didn't have any civilians here. The last person that we did have there was moved to records because they needed somebody in records under the other administration, which left nobody in corrections to do those functions. After the Savage Plan, we addressed some of the stuff in the study, and we put some things in place. As far as PREA goes, per our collective bargaining agreement, whenever we turn around and create a new position, you have to post it for 10 days. So a couple days ago, we posted for a PREA's compliance officer. What that person will do is we'll pull somebody from staff, and they will be monitoring the PREA processes, those 45 standards that we have to make sure that we abide by and follow to make sure they're being done properly. A lot of that has to do with security, risk assessments, making sure that the staff as well as medical department has a specialty training in PREA that's required, make sure all volunteers that come in, all contractors that come in have been PREA compliant and have the PREA training prior to them coming out to the facility. The lockdowns, in January of this year, we were at 432.25 hours. In February this year, we were at 732.5. Lockdowns happen for a variety of reasons. Mostly it comes back to staffing. We have right now 40 officers on each day shift and 33 officers on each night shift. That's not including PI, training, or court personnel. So if there's an emergency and somebody has to go to the hospital, we have to shut down 2 units, send 2 of our staff to the hospital with this inmate. Lately, we've had a lot of medical transports. We've had up to 4 or 5 inmates in the hospital at one time. Not to mention the fact that during the day, we have writs that we have to go to other counties. So every time Boone County, McHenry County, Kane County, Cook County has somebody that we're holding on our charges, they have to go to court, we have to pull 2 people to transfer those to each of those counties. So there's some days that we might have to go to 4 different counties all at 9 o'clock in the morning. So you're talking about 16 staff members there. So that's one of the problems that are creating the lockdowns. 30-minute cell checks, back in 17 and 18, they exceeded the 30 minutes. So as of this year, when we had the audit done, it was after the the staffing study was done. We were in compliance. DOC came in, we were doing the best we can, hitting these rounds. But like I said, DOC's are stricter. If you're 1, 2, 3 minutes late, they ding you on it. So we do the best we can with what we have. DOC was impressed with the way the facility looks, same with the Savages who came in and did the staffing study. It's a very clean place. Staff's very professional. They do the best they can. They're exhausted, they're burnt out, but you know, they put it on every day when they come in there to make sure that their fellow officers and inmates are safe and secure inside the facility. One of the things that we address is, as far as the administrative staff, we're going to have a civilian hired to help out with the program and education part, and the receptionist to help with the mail and answer questions and answer phones at the front window there. let's see here. Right now, we're currently at 159 staff members. If you divide that between the 4 shifts that we have, plus court, that gives you 40 on each day shift, 33 on each night shift, and 10 for court, and 3 that do PI, training, and periodic imprisonment. Those numbers are down at the end. As the PREA coordinator each year, it's part of my responsibility to sit down with the sheriff and the superintendent and go to, and put a staffing plan in for the following year. The staffing plan that I do under the PREA requirements are based on the direct supervision staffing requirements, the positions and posts that are needed to safely operate that facility. This year's was based off the study that was done in 2006, where we were told that we needed 203 security staff members to run the facility properly and safely. I did not do the new one with the Savages because the report was due prior to the outcome of that study. The plan that they put in place was on the lower end. The suggestion is April 1st, hire 5 correctional officers, 1 administrative staff member, hire 3 more July 1st, and 3 more on October 1st. With the 11 additional people, it might cut down on some of the overtime, but you gotta understand that the direct supervision jail is based on direct supervision. It's based on the positions required to safely and securely operate that facility, and has very little to do with the amount of inmates. You could have 400 inmates, and you can have 1,000 inmates, but you still have those vital key posts that need to be staffed on a 24-hour basis. One thing I just wanted to add with the Savages that came in for the staffing study, I had reached out to Mark Goldberg and Associates, who did the original study in 2006. Mark had referred me to Glenn Atherton, who then referred me to the Savages. The Savages did not see or were not given a copy of the 2006 staffing study. They came in, they met with myself, the superintendent, Redmond. They started from scratch. It's the same calculations that they use at the National Institution of Corrections. They started from the ground up. The 3rd day they were there, their last day they were there, they sat down, showed us the numbers, and I told her it's almost identical to the one that was done in 2006 with the addition of 6 more staff members, which was due to the 2 court buildings that we now have to transfer to. So that's where the 6 additional officers came from. So that's all I have. If anybody has any questions.
Any questions? Yes, sir, Mr. Tassoni.
Thank you, Mr. Chairman. I apologize if you maybe mentioned it. Are there any current funded vacancies in the corrections at this time?
I believe my understanding was the board set a number of 159. That's what the board budgeted for, so no.
Okay, thank you.
I don't think that's accurate. Not accurate. Just a point of clarification, the state's attorney reacted, as did I. I don't believe there was a number set, there was a dollar amount assigned. Am I saying that correct? Okay. But it probably leads up to a certain number of folks.
Yeah,
So the dollar amount was
The-
159 officers.
There's been a dance around that, and I just wanted to clarify.
And like I said, I just wanted to make sure that you guys really understood the concept behind a direct supervision facility. The old jail that we had was a linear one. That you could lock the inmates in there, the officer wasn't in there, they just had to go, do their 30-minute checks. When this building was designed, certified, and built as a direct supervision facility, that's what we have to go by. And those are based on the positions and the posts that are required to run it safely. Okay?
Thank you, Mr. Tassoni. Mr. Girl.
Thank you, Chairman. Thank you for the presentation. In your opinion, Mr. Pott, how many officers do you think the county should be looking at hiring to run a safe facility at the jail? I know we have 11 down there, and I know I know it's more, but in your professional opinion, what do you think that number, that good safe number would be?
Realistically, I would like to see what the staffing study shows, 209. But in the interim, I think there should be a plan set to reach that number. Right now, we're looking at 180 as a starting point to get some of the overtime down and to comply with the PREA standard requirements and what we have in place with the federal marshals. Because at the end of the day, you need to make sure that not only is our staff safe and secure, that the inmates are also safe and secure. And these posts are really vital. I mean, sometimes it's a game of, okay, we're gonna shut down this unit, or we're not gonna fill this post to do this post. I think back in 2008, we were at 200 staff members, and I believe the overtime was nil to none. And we were only 3 off from what that study showed the requirement, including the civilian positions at that time. And since 2008, as the number of officers gone down, the overtime's increase reflects that.
Absolutely. Thank you. Thank you. I appreciate what you do in the jail and your staff too. They have a thankless job.
Thank you very much. Just to follow up for because I always look at, there was a time before I think the public safety system, the board, back a few boards ago, they did a series of things that reduced the population in the jail. And I believe in 2008, the population in the jail would have been significantly higher at that time and has since come down. I know for some of the longer standing board members, there was some efforts made, and then you did see a decrease in the jail population. Don't need exact numbers, but I know that was, I think in that 2008 was higher.
What I have here, in 2008, the average daily population for the 200 staff members we had were 459. And then as the years go up, it's 76, 500, 525, 633, 555, 484, 604, 665, 758, 801, 856, 960, 1,019, 953, 837, 690, 771 in 2016. 2017 was 801. 2018 was 810, and 2019 was right around 781. So the numbers of inmates, the average population keeps going up, and the staff numbers keep going down.
We could actually put that chart back up if you want, but the chart shows from 2008. Inmate numbers go up until about 2012, where they peak at a little over 1,000 a day, and then they come down to 2019, where they come down to about 780 inmates a day. So there was an uptrend from 2008 to 2011, and then 12, and then since then it's down slightly.
So in 2012, we were at 1,000, average 1,000. Today, we're around 700.
We're just on.
We're just under 800.
Just under 800.
Yeah.
Currently, the current population of jail today is around 700, but that could fluctuate.
And then in 2012, how many corrections officers did we have?
In 2012, 174.
And 74. So, okay. I wanted to understand that give and take.
Right.
Thank you. Okay. Any questions, any follow-up questions? Seeing none, thank you very much for sharing that information. Really appreciate it. Next item of business, we do not have any public comment tonight, so we'll go to board member correspondence. Any comments or questions? Mr. Boomer.
Yeah. It was due to my real job workload and wanting to spend more time with my children before they go to college. I'm resigning from this board at this moment with a heavy heart. I've learned a lot, gained a lot of friends, and miss y'all, and peace out. I'm done.
Thank you very much, Mr. Boomer. So then we will note that for the record, the resignation effective immediately. Okay. Thank you, Mr. Boomer, for your service. Any other comments or questions by board members? Seeing none, we will go to chairman's report. Just very quickly, I know there's been several board members, Mr. McDonald, one of them texted me, hey, will Dr. Martell have an opportunity this evening to update on the news from today, the coronavirus discussion, and absolutely that'll be the case. I'll defer it off of my report now to just in a few minutes. The only other thing I had is the mental health. The mental health board, you're probably tired of hearing about it because it's come up at about the last 3 meetings. The 2 individuals for the at-large appointments, now that we thank you to you at our last board meeting, we've seated the first 7 board members. The first 7 board members got together last Friday. Mrs. Rudd and Mrs. Gorel were there, thank you. and they immediately requested that we add the 2 additional at-large members. You've heard those names, Dr. Julie Morris and Reverend Dr. Copeland. You've seen their resumes over the last 3+ weeks, and they are on the agenda this evening. This is our last board meeting before the election, and I do know there's at least a request. It's ultimately a board decision if we could, in fact, suspend the rules and appoint them this evening. They are highly qualified and exceptional, and those 2 folks, their names have been public for 3+ weeks now, and there's not been one call or concern shared by a board member about them, and a lot of enthusiasm by the community. So it's ultimately your decision, but that request has been made for what that's worth. With that, I will move on to announcements and communications. Clerk Gummow.
Thank you, Mr. Chairman. The items listed below are received as correspondence.
And we will place those on file. Consent agenda. Consent agenda. May I please have a motion to approve the consent agenda? And that would include the raffle report, approval of the February 13th minutes, and layover of the February 27th minutes. Motion by Mr. Feller, second by Mr. Billick. Thank you very much. These 3 items are before the board under the consent agenda. Any discussion or questions? Seeing none, all those in favor signify by saying aye. Aye. Are there any opposed? Motion passes unanimously. Thank you very much. Next item of business, County Administrator's Report. Steve.
Thank you, Mr. Chairman. The only item I had in kind of follow-up to the issue of the virus and so on, River Bluff has, effective tonight, is closed to visitors until further notice, unless there's a essential reason that they need to be there. They've taken precautions, I think, starting last week regarding taking temperatures, things such as that of not only staff but visitors and so on. But they feel that this is important to keep the outsiders out of there, to keep the residents safe. So,
Thank you. Thank you very much. Mrs. Gorel.
Thank you, Chairman. There's another thing to that, too. They won't be taking any new admissions for a while either, until this calms down and they feel it's safe to do so. Thank you.
Thank you very much. Thank you, Steve. With that, we'll move on to department head reports. We do have from our office, Stacy Mullins has a quick update on the census. And then I know there's, I think, one other department mention, and then I know Dr. Martell had some comments as well. Thank you, Stacy.
Thank you, Chairman. So I don't know if you've heard, but we have commercials out. We have radio out right now in regards to the census, so you may have already heard it. But an update on a few of the questions that you may have. The census has been around since 1790, over a couple hundred years. So it's something that's been going around for a long time. It's just a matter of, it's changed over the years. We do take a census every 10 years because it is mandated by the Article 1, Section 2 of the United States Constitution. So that's why we do that. The information, no, I didn't. There we go. Okay. Your information, a lot of people do ask, is it safe? Yes, it is safe. As far as we can say safe is. So, but it is protected by federal law. So anybody that does work for the census, obviously they're not able to give out that information. So as far as anyone can say, when it comes to the internet and information, it is safe.
Okay.
You should be getting a response in the mail within the next week to 2 weeks on how to go ahead and fill it out. There are 3 ways to fill out your census. One is by mail, one's by phone, and one is by online. This year is the first year that you are able to do it online. So I don't have DVR on my TV, so if you're sitting there watching TV and you don't have, I watch commercials all the time, so that's when I go to my Facebook or internet. Please feel free to fill it out because it's only going to take you about 10 minutes to fill out the census. It's really quick. There's only 9 questions. If you don't respond, you will get a paper questionnaire in the mail, which you can then mail back in. They would prefer not, because obviously that's stamps going out and in, and we'd prefer to save some money if that's possible. If you don't fill out the questionnaire, you're going to get a postcard. If you don't get a postcard, then an enumerator will visit your home. What is an enumerator? It's a trained census taker. And they will come to your home once, twice, maybe 3 times. So the 10 minutes online is really easy to fill it out. So I would suggest doing that, if you can, please. Why do we do the census? Because it's important. Illinois stands to lose $1,500 per year for each person that does not fill it out. It also, we can determine how many people we have representing us with the U.S. House of Representatives. In 2010, when we last did the census, we lost a representative. The way it's projected for this year, we're going to lose another one. So hopefully, everybody will fill it out. Local resource allocation. These are just a few of services that are funded that use the census numbers to allocate money. So the list up there on the PowerPoint, it's just a few of the organizations that use the money. So we really want to keep it in this region and not another state. So last year, there were 5 counties that got together and came together for a count initiative. They are listed up there: Winnebago, Boone, Ogle, Stevenson, and DeKalb counties. All of the ones below there, we've launched marketing and outreach efforts, including buying radio ads, billboards, posters, to get the word out, because if you see it over and over and over again, maybe you will actually go online or respond with your census via email, phone calls, mailing back in your census. We also have events going on. The county is going to be sponsoring an event, which is a run at Rock Valley College on May 1st. So we're going to have a table there. I'll have a tablet trying to catch those teenagers running around the track, and anybody else that's there, any other sponsors. So a number of events are going on in libraries, in town halls, the mall. We have people, census takers with tablets all over the place. So if you see them, just say hi and say thanks, because it's a lot of work putting this together. And how you can get involved. Just fill out the census. Like I said, it's 10 minutes, simple, easy, 9 questions. On your place setting right there, it says, it gives you answers to why they ask certain questions. So when you're out and about talking to constituents or your family, friends, mention it. We'd certainly appreciate that, because we do want to keep the money in Illinois for obvious reasons and not other states. If you have any questions, you can go online at those emails, and please feel free to call me, contact me. If I can't answer it, I will find the answer for you. If not, I'll make it up and it'll sound really good.
Thank you, Stacy. Any questions for Stacy on this? I know for some of our longer-serving board members, it's a bit of a review, but I think she encapsulated the reasons why this really does matter very well. So thank you, Stacy. Steve, thanks for the idea on giving an overview on this. With that, are there any other department head updates? I know that Dr. Martell did have a couple things to add. There were some questions on the press conference today, and I know this is a developing situation. Thanks again, Stacy.
So thank you, Chairman. I wanted to give the county board an update on our community mitigation standards. So as we've been watching the coronavirus kind of evolve, we've seen the number of case counts grow in the state of Illinois. We've seen other states have difficulties with containment. And while we have no confirmed cases in Winnebago County, we began to look at how could we could get ahead of the curve if we worked on this, which is looking at shutting down community events. And why would we do that, right? We know that that is it impacts economics, it impacts psyche, but more importantly, what we're trying to do is eliminate community transmission possibility, right? Because when groups are gathered around, this is where the virus spreads. It needs every single one of us to help spread it. Our highest risk populations are the population of 60 and over, and anyone with a chronic medical condition. If I were to ask you to raise your hand, there would probably be a lot of people sitting out in our audience in our room. And so in order to protect that population that's most at risk, we began to look at those mass gatherings. And someone asked, why 25? And why we said 25 was, typically you'll know who's in a circle of 25, and we can do a contact investigation. If you are sitting at the BMO in a certain section and tell me, and there's a case or a contact in there, how many people do you think we can outreach to? What does that do to our healthcare system about people coming in saying, I heard there was a case at the BMO, I'm going to show up, I need to get tested. Every contact has to be quarantined for 2 weeks. So these become very prolonged situations, and we felt that we could get ahead of this. As the city of Chicago, as other areas began closing down activities and events, we thought we do not want to be a destination for this. It's an opportunity for us to take a look. And so in partnership, in support with our elected officials throughout Winnebago County, our business community, this is not an easy decision, and we did not take it lightly. We began those discussions and preparations. How can we work as a community, as a team, to really begin that process of community mitigation? How can we stop the potential transfer of this virus in our community? So again, River Bluff Nursing Home, but all of the nursing homes in Winnebago County, this had already started in the collar counties surrounding the city of Chicago. We already had our heightened flu enhanced surveillance and not allowing visitors under 18. We've now restricted all visitors in that, except for end-of-life care. Staff that are working there are subject to temperature taking to ensure that our most vulnerable population and one that the county cares for specifically is at highest, protection that we can provide at this particular time. All of their nursing homes and skilled facilities, so it's not a competitive advantage, are in the same boat. So we put that out there. As you would guess, we have many different tournaments going on. So some are able to continue if they can maintain distancing and spacing, or their live video streaming with no, I'm going to say participants in the audience and no people that are out there. You'll see some of them are able to do that. Others said there's no way we can, ensure that. And so those decisions are being made. There are venues that are able to be open because they're able to maintain their social distancing. So each one of the scenarios is really something that we work through the process of how can you do this to support this strategy to help us contain the disease. I want to say schools are not at risk. Schools are still in session. They are considered essential functions, as are after school. If there was a case in a school, we would work through it in a very different way and process. We are working with our first responder community, who I have enhanced screening questions on the 9/11 and PSAT calls, we'll call it, so that we can assess that. But we really needed everyone to pull together on this, so we can do this. This is the first time in a very long time in this country's history where we've had to take some very strong, hard actions to prevent a communicable disease. So if you have questions, I'm happy to respond to them. I do support and thank the support of the chairman and our business community, who are really having to step up to this as well.
I see hands. If I got one out of order, I apologize. Mr. Fellers, then Mr. Billick, then Mr. Girl. Mr. Fellers.
Thank you, Mr. Chairman, and thank you, Dr. Martell, for your leadership on this. A couple questions, just because I've had this come up in the last week with constituents. So I'll just lay this out as an example. Like my daughter's swim team, her state meets, her regional meets, the national meets were all canceled, as they should. And, you know, there are parents who are like, hey, let's get all the kids together for a big pasta party in 2 weeks, or let's all go to the pool and we'll do a big meet like this. I think there's a little bit of confusion on sort of what a community event means. And I've done my best to try to explain to them, but like you're essentially saying any gathering of people greater than 25 in any sort of closed facility, say like a restaurant, would be a bad idea.
Okay, let's start. If you're doing that, you've got to know, and we've put some, parameters in place. Restaurants are still open, businesses are still open. If you cannot maintain, if you've got a gathering where 25 people mass together and you don't know who they are and identify with them, that is a concern, right? So that's where we're going with. If you have a private party in your home with 25 guests, you know who they are. And if there was a contact in one of those, I would call you up and I would ask you for their phone numbers and how to get in touch with them. And you would have to provide that information to us.
So I guess this is a follow-up. So like if, I mean, we're talking maybe 100 kids and parents, right? But we do all know each other because it is a team, right? I'm trying to help guide.
That would not be the best time to do that. I would suggest postponing it.
Thank you.
And again, these are difficult times for people, and they're not used to having to think. We talk about pandemic flu, and I don't want to I know you're all very busy. There are 3 things we expect with the pandemic flu, and we've been kind of talking about this. One is a disruption in your employment practices, right? If 60% of your workforce can't make it in, whether you're a correctional facility, a healthcare facility, you're a construction, funeral director, any of those, think of what that would do, right? Because they're either being quarantined for, purposes, or they may be actually ill. The next is supply chain, and we've been hearing that discussion all along. You've been hearing about the personal protective equipment shortages regarding masks and gowns and gloves. Also, some of the other areas of manufacturing and things are having difficulty getting parts, the auto industry. And then there's commerce. There is a disruption. And unfortunately, I'd like to minimize the disruption by minimizing the amount of disease in the community. If we can see this through, hopefully minimize the disruption in people's health, we can minimize the disruption overall.
I'm sorry, I had Mr. Fellers. Thank you, Mr. Billick.
Thank you, Mr. Chairman. First off, Dr. Martell, I do want to thank you and your staff. I know that you had actually recently reached out by email and you jumped on it immediately for a lot of the restaurants and bars in the area and other public places, and you made sure that anybody that has to go through the health department was notified to have the extra checks and balances. So I do want to notify that has happened, and thank you for that.
Thank you.
My question to you is actually just in regards to the restaurants and bars and stuff like that. Have you seen any conversation that is going to be changing whatsoever? This is one of the busiest weekends for a lot of businesses locally, and just as a kind of a courtesy, because I deal with a lot of those businesses, what should they expect, if there is anything to expect that we know of right now?
If we have to extend those community mitigation recommendations, we would do it. If we had a case, we could identify it was being transmitted, we would certainly want to take the next level of step. Again, looking at patterns, what we've said is look at ways, for every scenario is somewhat different, but the general guidance would be try and keep those minimized groups. So if you had a big 25 group of pack, we would want to say spread it out, right? Can you open up your air exchangers? These are kinds of things that we would do. Most people in a restaurant do not spend significant time. They're sitting across from a person they know. They eat dinner, they leave. We know that this is a big weekend. We had to be very cautious with the St. Patrick's Day parade. There was concern as well, because in a parade, do I know who attended? And if we found out there was a case, we'd have to put a notice out that if you were at the St. Patrick's Day parade, you may have been exposed to coronavirus. You know how many contacts it would have overwhelmed our healthcare system. And we have to be thoughtful about that, because we'd have people going and concerned. For every time someone comes into any of our clinics that says, I've been exposed, or I think I have coronavirus, we have to do a thorough investigation. And that means sometimes contacting out-of-state health department. We had some incidents today. We've had to contact into those communities and say, is this person on a contact list? So this requires a great deal of background check to make sure that we're not spreading the disease.
Thank you, Mr. Bilek. I have Mr. Gurl. Mr. Gurl.
Thank you, Chairman. Thank you, Dr. Martell. I did watch the press briefing today. I think we did a wonderful job, and especially you and your staff. My question is, are we ready as a community if 40% or 60% of our residents need testing? And then if there is a percentage of those that do need to be hospitalized, do we have enough beds in this county to say, to use the 10% or 8% of the folks that do come down with this that need hospitalization? Do we have enough beds in the county to accommodate them?
Dr. Martell?
We constantly look and plan for this because we're also regional beds, right? So the good news about this particular virus, while it does impact certain populations at higher rates and higher mortality, the death rate out of China was 1.4%. So the majority of individuals have disease and illness and recover. The problem is in a community transmission, you can't tell who you might expose that might have some difficulty. Right now, we've all been watching the national press and news about the shortage of test kits and availability of test kits. Every single one of our health system clinics is able to obtain a specimen. We encourage all members of the public to call before they go in. We are not testing people that are not symptomatic and have no exposure. We have a lot of people saying, can you just check to see if I have it? The test is standardized against positive for disease. And again, that takes it out of individuals who might need to be tested because they exhibit signs and symptoms. So typically when a person's put in quarantine, they are not tested. If they develop symptoms, then we have them tested. The turnaround time right now for our state laboratory system is 72 hours. So that means at a minimum, someone's put in quarantine for 72 hours. If they're sick, they're isolated for 72 hours. So that becomes very important for people to understand. It's not an automatic test. They're not going to run it in the doctor's office immediately. It takes a while to get those results back out. The commercial labs are starting up, and we understand there'll be 3 to 5 days on the turnaround time for commercial lab.
Okay. And just to follow up if I can, I know a large percentage, well, I'm not sure the percentage of people over 60 in this community, but I can imagine that number is far greater than 50,000. I would have to assume.
And also chronic condition.
Absolutely. So if just a percentage of those folks came down and need hospitalization, we know that hospitals usually don't have open rooms. They usually don't have open beds because that doesn't produce a profit. So if there is a need for 5,000 people to be hospitalized, is there a plan in place in case this does get to that point?
There are plans called mass casualty management plans, and yes, there are plans in place. There are mobile hospital units that come out. The strategic national stockpile includes what's called a vendor management inventory. Now, this disease has no medications, right? So we're not giving vaccinations and we're not giving medicine. So it's supportive care. So if people need ventilation and we need to access that, you heard both the governor declare so that he can access. Our state strategic national stockpile has been activated. We have used our local, what we call Winnebago County cash for institutions that need some of the supplies, and we will then kind of go up the chain to the federal assets as well.
Excellent, thank you. I think the people need to know that there is a plan in place.
Yes.
Panic is not needed, and you guys are on top of it, so.
Our goal is not to need it.
Absolutely, and they should get their information about this through the county health department.
Correct.
And not the media.
And whatever you can do to, again, dampen the anxiety. So we have the Emergency Operations Center under the Winnebago County Sheriff has been activated as of 1 o'clock today. We have the Joint Information Center has been established, and that consists of all the public information officers from a variety of institutions, not just the health department. They are fielding calls. We'll be posting up numbers. It's very important that you not share information like, I heard so-and-so was sick with coronavirus, because when that spreads to a school, they may have to then activate. We may have to, again, the investigation that requires, and sometimes we find that they preemptively, the messaging out to the community is, oh my gosh, and we really need to be able to convey factual information, timely information, and it does require us to get involved. We're open 24/7. We're taking calls all night long, as you would guess, to confirm and then authorize testing as indicated.
Excellent, thank you. And I should say, not the media, but the internet. Thank you.
I think, and to your point, Mr. Girl, their office has done a nice job of pushing out approved science-based information to the media, who's then passed them on to the community. And so, well said. Mr. Booker, and I think there was another hand up. Mr. Booker.
Thank you, Chairman. Thank you, Doctor. My curiosity, my wonderment actually revolves around the influenza and pneumonia. We're currently in the cold and flu season, and the flu so far this season has caused several thousand deaths. Pneumonia is at like 6.7%, and I think the epidemic range is 7.5, something like that. So we haven't taken any steps nationwide anywhere, as far as I know, on the flu and the pneumonia. And the coronavirus has caused, let's see, nationwide, I believe it's still under 50, and several of those were nursing home related. I'm just wondering why we didn't see this type of action during the, when the flu and pneumonia deaths were up, and as I say, several thousand people have died of flu and pneumonia alone.
I can't speak to nationally, but I can tell you that this community does an influenza-wide plan. So when our influenza rate goes above our baseline, we then begin what's called visitor restrictions at hospitals under the age of 18, masking of unvaccinated healthcare workers in an attempt to ramp that down. Because you're right, flu is something that we see every year. We had our first pediatric flu death in 10 years this year. And again, we have to get our messaging out to the community. There is a vaccine that's offered annually for our seasonal influenza, and we do have pneumonia vaccine. So we encourage those individuals who are eligible to get their flu every year, which is everyone over the age of 6 months, and then the pneumonia vaccine.
Thank you. And just to follow up, the coronavirus, though, it's, I'm not saying that the county hasn't taken sufficient steps for the flu and pneumonia. I'm not saying that at all. I don't want that to be taken the wrong way, because I know we're on top of that. But the coronavirus, I mean, my gosh, shutting so much down and limiting people movement for, again, less than 50 deaths nationwide.
And again, because I think there's limited information, pandemic, when we use the term pandemic, there's a number associated with it, but it's also because it's a novel virus, meaning we have not seen this before. So we don't know how it's going to behave over the long term. And that's been a huge concern, which is why this community transmission piece is so. Initially, the only cases we had in the United States were those that could be traced back to Wuhan, China, that kind of thing. Now we've got cases that, when our first person-to-person in Illinois, the person-to-person contact was related to people that were, spouses, right? That was the first person-to-person. We now have some individuals, we have people coming back from Italy, who now is another country that have it. And we've had individuals, one individual in Illinois right now, which there is no known exposure, so they cannot trace it back to a country where we thought it was or another case of COVID-19. And that's the concern, is that typically with influenza, we know how it behaves to some extent, but viruses always mutate. So this is why every year you get a new flu vaccine.
Good, Mr. Booker, there was a hand up. Mr. Feller's on a follow-up.
Thank you. Just, sorry, remind me of a couple other quick things. When you talk about sort of, community transmission and sort of these mitigation factors here, correct me if I'm wrong, the point of this is to ensure that, and to go to Mr. Girl's point, that we don't overwhelm our healthcare system, right? That we don't see a spike in cases that would happen all at once, and we are unable to. We have to put in a mass casualty plan, because we do run out of beds. By limiting, by social distancing and by limiting contact with other people, self-quarantining, et cetera, we can keep the current number of cases low enough that our health system can handle it. Is that correct?
That is correct, and we can do this.
Right. The other one, have you worked with the Sheriff's Department on a mitigation plan to protect the inmates in the county jail?
They receive, they're part of our call. We do a briefing call. Many of you receive the invite or participate in other areas. We have we were having a liaison call, which kind of general information. There is pushed out guidance based on the circumstances. The CDC is pushing out a lot of guidance on specialty, whether it's school, correctional facilities, hospital and healthcare workers, first responders. They have one for mortuary care and funeral directors. We have a lot of materials up there. And again, there's specialty questions, and then there's overall concepts, which all of us can apply.
Thank you. No, I've been listening on liaison calls. I appreciate that.
Thank you, Mr. Fellers. Mr. Arena.
Thank you, Mr. Chairman. And thank you, Dr. Martell, for the information, for what you've shared with me over the last few days. One of the things I had asked for was information to share with the public, you know, with my tenants in my buildings. I think you have some great documents here that are in our packet. And, you know, when I read them, one of the things that I guess I wouldn't have thought of myself is that if you're sick, call the doctor before you visit. I think that's the type of information that all of us could work on distributing. I'm taking these pamphlets that they have in our packet and posting them at my buildings. And I would encourage all of you and, you know, your areas to encourage businesses and other landlords to do the same, so that people, assuming that people at some point may become sick, they act in a way that reduces the spread. So I think this is a great one-page brochure with some simple, easy-to-understand information, and thank you for that.
It's a very good point. Any other questions or comments? I'm sorry if I missed Dan. Yes, sir, Mr. McDonald.
Thank you, Mr. Chairman. Just a couple quick points. On my volunteer fire department, we did get a call for possible COVID-19. They stated that county sheriff was en route, so I checked with the sheriff's department. They assured me that our dispatcher had it wrong. I think it's important for you guys to know, for hazard mitigation, our deputies are not going inside these houses. Our deputies are not making contact with these people. They're saving that for the people, the trained people on the ambulances. So I commend the sheriff's department for making that call, and I just thought I'd share that with all of the rest of you. The question I have for you, Dr. Martell, the national shortage of hand sanitizer. Are we better off just washing with soap and water or hand sanitizer?
Washing your hands with soap and water is the gold standard for hand hygiene. So if you do not have hand sanitizer, do not make it with, you know, recipes off the internet, not approved. Wash your hands under soap and water for 20 seconds. And for children, we always say sing happy birthday twice. You can sing it to yourself twice, or twinkle little star. You know, I mean, these are things that we really can practice. These are things that are time and trude, right, you know?
There was a conference call with the area mayors this morning, and Dr. Martell made the point at a point to the mayors who asked, don't waste your vodka on making homemade sanitizer. Follow-up, Mr. Fellers.
Sorry, I had to pull this out there. If you guys go to washyourlyrics.com, you can enter your favorite song and artist into it. It'll tell you how long of that song you have to sing to properly wash your hands for the long time if you don't feel like singing happy birthday twice.
On that note, thank you very much. Dr. Martell, anything else? Thank you, Dr. Martell. Okay, next item of business, standing committee reports, Personnel and Policy Committee, Mr. Fiducia.
Thank you, Mr. Chairman. Your Personnel and Policies Committee has a one item, and that's going to be for a first reading, and that is an ordinance amending the rules and orders of procedure of the County Board, Winnebago County, and that's in for a first reading.
Thank you, Mr. Fiducia. Mrs. Crosby.
The rules, please.
So we have a motion by Mrs. Crosby to suspend the rules, which would allow us to vote on this item separately this evening. I have a motion by Mrs. Crosby, a second by Mr. Westcott, Mr. Booker, Mr. Kelly, Mr. Fellers. The motion is second to suspend the rules, which will allow us to vote this evening, is now before the board. Any questions on suspension of the rules? Seeing none, all those in favor signify by saying aye. Aye. Are there any opposed? We want to note for the record, Mr. Schultz, Mr. Arena are no votes. We will cast a yes vote for all other members present. Motion to suspend has passed. And then Mr. Fiducia.
Thank you, Mr. Chairman, and I would like to so move that ordinance.
We got a motion by Mr. Fiducia on the ordinance amending rules of order and procedure of the county board of the county Winnebago, Illinois. May I have a second to get that on the floor? Mrs. Crosby. Motion has been, we've had a motion and a second on this ordinance now that we have suspended the rules. Any discussion? Seeing none, so a yes vote would pass the ordinance, a no vote would obviously reject the ordinance. And with that, I will ask the clerk to please call the roll.
Thank you, Mr. Chairman.
And just to clarify for the record, this is a change in board rules midterm, so that would require 12 votes. Is that correct, Mr. Kurlinkus? 11 votes, I apologize. So we need 11 votes.
Roll Mr. Tassoni.
No.
Mr. Webster.
Yes.
Mr. Westcott.
No.
Mr. Arena.
Yes.
Mr. Billich.
No.
Mr. Booker.
No.
Mr. Butita.
No.
Mrs. Crosby.
No.
Mr. Fellers.
No.
Mr. Fiducia.
Yes.
Mr. Gurl.
No.
Mrs. Gorel.
No.
Mr. Hoffman.
No.
Mr. Kelly.
No.
Mr. McDonald.
No.
Mr. Neighbors.
No.
Mr. Salgado.
Yes.
Mr. Schultz.
Yes.
5 yes. 13 no, and 2 absent, Mr. Chairman.
Motion fails. Mr. Fiducia.
Thank you, Mr. Chairman, and that concludes our report.
Thank you very much. Next item of business, Finance Committee.
Thank you, Mr. Chairman. The Finance Committee has 3 items tonight, and the first one is a resolution authorizing settlement of a claim against the County Winnebago entitled Melissa Dennis versus the Winnebago County, and I so move.
We got a motion by Mr. Salgado on the resolution related to Melissa Dennis versus Winnebago County. May I have a second? Thank you, Mr. Hoffman, Mrs. Crosby. Item is now before the board. Any discussion or comment? Could we just, for the record, get the amount of money again? I know we talked about it.
Yes, it is $17,276.18.
Okay, thank you very much, Mr. Salgado. Any questions? Oh, yes, sir, Mr. Neighbors.
Thank you, Mr. Chairman. How did Finance Committee vote on this?
Unanimously passed.
Thank you, Mr. Neighbors. Thank you, Mr. Salgado. Any other questions? Seeing none, all those in favor signify by saying aye. Aye. Are there any opposed? Motion passes unanimously. Thank you very much, Mr. Salgado.
Thank you, Mr. Chairman. The next item is a resolution authorizing settlement of claim against the County of Winnebago entitled Brian Bouchette versus Winnebago County.
We got a motion by Mr. Salgado on the resolution related to Brian Bush, and I apologize if I'm butchering that, versus Winnebago County. May I have a second to Mr. Salgado? Mr. Hoffman, again, thank you. That is now before the board, and just to get the amount again.
Yes, this item is $7,188.31.
Thank you very much. Any discussion by board members? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. Thank you very much, Mr. Salgado.
Thank you, Mr. Chairman. The next item is 2020-016 budget amendment, county jail. Supposed to be laid over, but I move to suspend the rules and vote on this today.
Thank you. Mr. Salgado has a motion to suspend, which would allow us to take a separate act and vote tonight on this. Motion by Mr. Salgado, second by Mr. Westcott, Mr. Hoffman, Mr. Fellers, and I missed a hand, Mr. Gurl. Motion to suspend is before the board. Any discussion on suspending the rules? All those in favor of suspending the rules signify by saying aye. Aye. Are there any opposed? We have suspended the rules. Thank you very much, Mr. Salgado.
Thank you, Mr. Chairman. So I move to approve Budget Amendment 2020-016, the county jail.
Motion by Mr. Salgado on 2020-016 budget amendment related to the county jail. Second by Mr. Fellers. Item and Mr. Westcott, Mr. Hoffman, and so now the item is now before the board for discussion. Any discussion or questions?
Mr.
Yes,
Chairman.
Oh, I'm sorry. I'll
I
go
can
to
speak to that. Thank you.
chair of that committee first.
Yes, so I'd like to give some synopsis on this. So we all aware, we got the U.S. Marshal letter. For those that weren't able to attend, just quick synopsis. They requested, obviously, the staffing shortages. They kind of talked about it in their presentation, the Sheriff's Department, on the 30 welfare check, the PREA interviews, and on that aspect of it. So there was another item I can't recall right off the top of my head, but those were the three things that were concerning to the U.S. Marshals. Out of that, they developed the operational plan. They went through and kind of elaborated on 11, correctional officers that they want to do that with one civilian. So this budget amendment here is the attempt to essentially allocate those funds for this year. We understand that next year there's going to be additional costs. Those we'll have those discussions during the budget process, but it lays the foundation so we can continue to address those issues from the U.S. Marshal. It is a contract that potentially is beneficial to the county. It does not address the issues. I want to be crystal clear on this. This does not solve our issue on spending and our budget that we have currently out there. There's been discussions about, it's going to bring another $900 to $1 million. It sure does. However, if you take the numbers and the overtime, those are things that we need to take into consideration before we start saying, I know there was comments, let's add another 20 correctional officers right off the bat. And my inclination is like, let's slow down. We have an operational plan going forward, presented tomorrow. That's why we're voting on it today, and I think it's very critical that we pass this today. So it gives assurance to the U.S. Marshals that we are adamantly in favor of resolving some of the issues that are currently going on, from their report, from the Savage report, from the state reports, whatever the case may be. So with that being said, this is what this budget amendment is entailed, is to capture that. It's around $253,000. $23,000 is going to come from, obviously, the commissary fund for the civilian. The remaining portion is based on what we receive, the $1 million or $900K that we're supposed to receive versus this expenditure, and then obviously and wherever we end up based on the spend-wise for the fiscal cycle will be taken into account. So if we exceed, obviously it's going to come out of the general fund reserves. That's how that's going to be. Now, could there be potential ability to actually save some money? That's to be seen. But I just want to be cautious about this. And I think it's a good plan to move forward. Let's not jump the gun here and make assumptions and based on our calculators that we get out and not looking at the overall picture. Because I can tell you that and I asked Mr. Bob Redmond yesterday this, can we overnight or whatever as of April 1st or whatever have 20 correctional officers? He said no. So let's be cautious about it. We have a plan in place. Obviously, we're going to get there. So I just wanted to bring that up, wanted to give the history for those that weren't able to attend. I think we did satisfy, the concerns. But tomorrow I believe they have to respond, and this is one of the ways that we can do so to show support that obviously we're going to get this done. So just wanted to point that out and get clarity on that.
Thank you, Mr. Salgado. I had a hand up, and if I'm missing somebody or going out of order, Mr. McDonald.
Thank you, Mr. Chairman. Just really quick, Mr. Chapman, if you could help me out. How much do we budget for in the federal inmate system, and how much are anticipated revenues for this budget year?
Steve?
Thank you, Mr. Chairman. I believe we budgeted $1.1 million, and I believe if the number of inmates stays at 65 through the end of the the fiscal year, which is another 6 months, it would be 1.6 mil.
That's excellent. So we're projected to possibly be $500,000 over what we had projected. I
In
think
that
that's-
revenue stream, yes.
In that revenue stream, thank you for, you're exactly right. And my point of that is we're looking to spend roughly half of that tonight, and I thank you guys. It sounds like the Chairman Salgado's on board with this as well. I think it's absolutely the right time to do it, the right thing to do, and I agree with Mr. Salgado. We should look at making this tonight, take a look at how our staffing looks, what overtime is doing, because these additional people, they're gonna help us get tasks done that we're not currently getting done. They'll have some impact to the overtime. So after these are in place, I'd really like to come back to the board, look at it again, and see maybe another 10, we can start chipping away from that $1 million of overtime and start doing a better job. Thank you.
I think Mr. Salgado laid it out very well. There's an immediate action and then future conversations that include some very tough budget discussions and operational discussions. Thank you, Mr. McDonald. Mr. Girl.
Thank you, Chairman. I just want to echo Mr. McDonald, and I first want to say this is a great start. I know we can do better, and I'm sure we will look at it in the future if the needs are there. So I just want to say thank you to Mr. Salgado, Mr. Redmond, and the sheriff, and to others that have been working on this. It's a great start. I know we should do more and we can do more. So I just hope that we can look at that in the future when it comes around. So thank you, Mr. Salgado.
Thank you very much, Mr. Girl. Mr. Arena.
Thank you, Mr. Chairman. I want to start by commending the sheriff and Mr. Redmond for their operation of the jail. You could tell when the marshal was here, they were very impressed with what they had seen. And for those that weren't able to come yesterday, my impression from the conversation is that we have a fantastic opportunity here to continue to expand our relationship with the federal government. We have space at the jail that's not being used, but we're still paying for the space. It would be wonderful if we can continue to build over time as we, satisfy their concerns with these new hires. We can look forward to possibly stepping up and maybe invite them to bring in more people. And I think it would be advantageous to the county financially to do so. So I think this is just a start, and I think we have a good opportunity before us. Thank you.
Thank you. Any other comments or questions? Yes, sir. Mr. Booker.
Thank you, Chairman. Yes, Mr. Arena stole my thunder a little bit, but if I could just add on that the federal government provides the revenue for these federal inmates. They have, by all rights and reason, they have every expectation that we have a sufficient amount of staff on board at all times. So with that revenue that they provide Winnebago County, that's the money that we've got to keep in mind in the future, that it's spent on staff, services, supplies. So again, that's their expectation with that money, that it's not spent, squandered anywhere else, but its intended purpose is for the federal inmates and sufficient staff. Thank you.
Thank you, Mr. Booker. Any other questions or comments? Seeing none, I will then go ahead and ask the clerk to call the roll. A yes vote passes, a no vote rejects.
Thank you, Mr. Chairman. Mr. Webster.
Yes.
Mr. Westcott.
Yes.
Mr. Arena.
Yes.
Mr. Billich.
Yes.
Mr. Booker.
Yes.
Mr. Butita.
Yes.
Mrs. Crosby.
Yes.
Mr. Fellers.
Yes.
Mr. Fiducia.
Yes.
Mr. Gurl.
Yes.
Mrs. Gorel.
Yes.
Mr. Hoffman.
Yes.
Mr. Kelly.
Yes.
Mr. McDonald.
Yes.
Mr. Neighbors.
Yes.
Mr. Salgado.
Yes.
Mr. Schultz. Mr. Tassoni.
Yes.
Motion passes, Mr. Chairman.
Thank you very much, Clerk Gamau. Mr. Salgado.
Yes, thank you, Mr. Chairman. And just to follow up on this, is I also want to thank Mr. Chapman and the Sheriff's Department for, I know we're in a tight deadline to get this tomorrow. So I think we did everything possible that we could do on that. I hope we can continue to have this relationship and monitor, obviously, our expenditures and where our revenues are going to be. So I'm looking forward to continuing to work that direction. So I think we're headed in the right direction. And that concludes our report. Thank you very much.
Thank you, Mr. Salgado. Next item of business is, I'm sorry, Mr. Fellers.
Thank you, Mr. Chairman. I thought I'd just use this time right now. Given what we've heard from the coronavirus, the preparations that are being made, and the potential economic impact, I think it would be wise for the Finance Committee and the administration to review our budget, our expenditures, and our projected incomes, especially as people social distance, spend less time in stores, less time shopping in person, and more time online. This could have a significant impact on both our public safety sales tax as well as our other revenue streams, and we should at least have some sort of plan in place to understand, what to do in the event that revenues do not pace out the way we projected, given if, what may hopefully be a temporary economic downturn, but definitely looks like to be at least some sort of, economic downturn.
That'll need to be monitored, absolutely. Thank you, Mr. Fellers. Next item of business, zoning committee, Mr. Webster.
Thank you. Your zoning committee has one item on our agenda tonight. It's due to be voted on. This was laid over at our prior meeting, Z0120, and this came with the recommendation of approval unanimously from Zoning Board of Appeals, and likewise unanimous approval from Zoning Committee. And I would move to approve.
We got a motion by Mr. Webster on Z0120 map amendment. May I have a second, please? Mr. Billick, Mrs. Gorel, thank you. Item is now before the board for discussion and questions. Any discussion or questions? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. Thank you very much. Mr. Webster.
Thank you. Our next zoning committee meeting will be March 25th, 2020. Thank you.
Thank you, Mr. Webster. Next item of business, Economic Development Committee, Mr. Billick.
To the point, right?
Thank you, Mr. Chairman. Thank you, Mr. Chairman. Tonight, the Economic Development Committee only has one item of business, and that is a resolution authorizing a grant of $2,500 to One Body Collaboratives Incorporated to assist with their program, Bridges Out of Poverty Community Workshop. And I so move.
We got a motion by Mr. Billick on the resolution related to One Body Collaboratives in the amount of $2,500, second by Mr. Fellers and Mr. Neighbors and Mr. Westcott. Thank you. Item is now before the board for discussion and comment. Any discussion or comment? Seeing none, all those in favor signify by saying aye. Aye. Are there any opposed? I know what you mean, Mr. Schultz. We're going to put Mr. Schultz down as a no vote. We know what he meant, and he wanted to be a no vote, so we're going to note that. Motion passes. Mr. Billick. Oh, thank you.
Thank you, Mr. Chairman. That concludes our report.
Next item of business, Operations Committee, Mr. McDonald.
Thank you, Mr. Chairman. Operations Committee has two resolutions for this evening. The first resolution authorizing additional services by Prairie Forge Group relating to the Public Safety Building Project. And I so move.
Motion by Mr. McDonald regarding the additional services for Prairie Forge Group related to the PSB. Mr. Hoffman, Mrs. Crosby, Mr. Betita on the second. Any discussion or questions by board members on this item? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. Thank you very much, Mr. McDonald.
Thank you, Mr. Chairman. Second resolution, awarding bids for countywide computer replacement, and I so move.
Got a motion by Mr. McDonald on the resolution awarding bids for county computer replacement. May I have a second? Mr. Westcott, thank you, and Mr. Gurl. Item is now before the board for discussion or comment. Seeing none, all those in favor signify by saying aye.
Aye.
Any opposed? Motion passes. I know we had Gus here tonight. In case you had questions, thank you for being here, and also glad that we got that thing done. Mr. McDonald.
Thank you, Mr. Chairman. I would just also like to ask, from what I understand, the city of Rockford's not vacating the public safety building yet. Looking forward, I'd like to see how that relationship looks. Where we go from there, we obviously have a substantial amount of overhead there, and I think we use very, very little of that. So I would like to kind of see how we can offset our costs if they're going to stay there. Thank you.
We will definitely get that to a committee near you in the very near future.
Thank you, Mr. Chairman.
Public Works Committee, Mr. Tassoni.
Thank you, Mr. Chairman. Public Works Committee brings forth one resolution, 20-009. It's a resolution of an intent to retire general obligation bonds with motor fuel tax dollars for improvements to Baxter Road, from I-39 to South Mulford Road, and South Mulford Road from Baxter Road to Edson Road, as well as Kishwaukee Road from Meridian Road to Beltline Road. I would so move.
We got a motion by Mr. Tassoni on 20-009, resolution regarding the retirement of general obligation bonds with MFT funds for improvements. A second by Mr. Webster and Mr. Gurl. Item is now before the board for discussion or comment. Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. Thank you very much, Mr. Tassoni.
Thank you, Mr. Chairman.
Public Safety Committee, Mr. Booker.
Thank you, Chairman. There's no report, and I'm looking to have a Public Safety Committee meeting before the next board meeting so that Armando Cardenas, Chairman of the Winnebago County Crime Commission, can present their goals and crime statistics, or strategy plan, I'm sorry. Excuse me, check that, so it was strategy plan. Thank you.
Thank you, Mr. Booker. We'll note that and look for the posting on the agenda. Any unfinished business by the board? Yes, sir, Mr. Schultz.
Thank you, Mr. Chairman. I did not have opportunity to prepare remarks regarding this, so bear with me. I just want to express my personal appreciation for the service of board member David Boomer. I'm grateful for how he served this community amongst us in this room, how he served his district, how he represented the interests of Winnebago County citizens, sometimes taking on very difficult and controversial issues for which he paid a dear price. And I'm grateful for his leadership. Thank you.
Thank you, Mr. Schultz. Any other unfinished business? Yes, sir, Mr. Hoffman.
Thank you, Chairman. I would also like to say that I thought Mr. Boomer was open to discussions and helped me get a Democrat in his finance chair and helped me get another Democrat in that should have been a long time ago, and Mr. Tassoni. So I appreciated that effort he gave me. Thank you.
Thank you, Mr. Hoffman. Mr. Billick.
I echo all the regards already made, and just commend him for all his efforts that he has always put forward. So, thank you.
Thank you, Mr. Billick. Mrs. Gorel.
Thank you, Chairman. I too am going to miss Mr. Boomer. I have to go along with the others before me, and I wish I could have said the same thing. But I think we all should just give him a hand and let him know that we all appreciated what he's done and hope he doesn't forget about us. Thank you.
Thank you, Mrs. Gorel. Yes, Marilyn.
Thank you, Mr. Chairman. As State's Attorney, I would just like to say for the record, it has been an absolute pleasure to work with Mr. Boomer. I found him to be very professional and to always have the mind of Winnebago County at the forefront of any interest and tasks that he took on, and I will certainly miss him. And I also would like to join all of you in thanking him for his stellar service over the years.
Thank you very much, Marilyn. Any other questions or any other comments on unfinished business? Seeing none, new business, we have several appointments before the board in for a first reading. Mr. Fellers?
Thank you, Mr. Chairman. I would just like to move we suspend the rules and act on these tonight.
So we got a motion by Mr. Fellers, a motion to take A, B, C, D, and E, and then suspend the rules and vote this evening. May I have a second, please? Second by Mrs. Crosby, Mr. Hoffman, Mr. Kelly, Mr. Neighbors, Mrs. Gorel, Mr. Girl. We motion a second on suspension of the rules to take these items this evening. Although, any comment on suspending the rules? We'll include Mr. Westcott as a second. Is that, okay. Any comment on that? All those in favor of suspending the rules signify by saying aye. Aye. Any opposed? We've suspended the rules, and I'll go back to Mr. Fellers.
Thank you. On this motion that we take all of these at once unless someone wants to pull one out.
We got a motion by Mr. Fellers to take A, B, C, D, and E, which would be related to the Mental Health Board, North Park Water, Harlem Roscoe Fire Protection, Northwest Fire Protection District, and 911 Emergency Telephone System. We got a motion, and that motion includes that if a board member wants to pull one of these out for a separate vote, meaning you may want to vote differently on that, you are welcome and have the latitude to do that as an individual board member. We got a second by Mr. Westcott and Mr. Hoffman. The item now is motioned and seconded, taking them as a whole. Any discussion or comment on these multitude of appointment items? Seeing none, all those in favor signify by saying aye. Aye. Are there any opposed? We've appointed or reappointed all of these individuals. Thank you very much for that consideration, Mr. Fellers.
It's a motion to adjourn.
Got a motion to adjourn by Mr. Fellers, seconds all over the place. Mr. Neighbors, Mr. Hoffman, Mr. Girl. All those in favor signify by saying aye. Aye. Have a great night. Thank you.